Hello everyone, myself Dr. Monalisa. Now starting with the discussion of Neet PG Anatomy MCQ part 14. Okay, so you can use this referral code of mine, that is Dr. Lisa-YT, for 10% discount if you wish to join the Unacademy Neet PG platform. Also, I would like to give you the information about the Telegram group link of Unacademy Neet PG platform. You can join the group via this link. I would also like to tell you about my own group, that is Monalisa Anatomy. You can join the Monalisa Anatomy group for the anatomy related queries. So now starting with today's session. So starting with the session of Neet PG Anatomy MCQs. So this is the first MCQ which I am going to describe. Now, which is not an anterior vertebral muscle? So options are Longus coli, Longus capitis, Splenius capitis, Rectus capitis, anterior muscle. So mark your answer and I will come to the explanation of the muscles. So this MCQ is related with the anterior vertebral muscle. So first thing is that what muscles are called as anterior vertebral muscle and which muscles are included in this group. Now anterior vertebral muscle is also called as prevertebral muscle. Okay, so anterior vertebral muscle is also called as perivertebral muscles. It is also called as perivertebral muscles. It is lying between the perivertebral fascia and the vertebral column. What is the location? It is sandwiched between this group of muscle, which is also called as anterior vertebral muscle, is lying between prevertebral fascia and that of the vertebral column. Now let me tell you about all the prevertebral muscles. So in this diagram, let me just highlight it. So the muscle of this category is Longus coli muscle. The first muscle is Longus coli muscle. Longus capitis muscle is the second muscle in this group, and also we have got Rectus Capitis lateralis and Rectus capitis anteriorly. So all these four muscles, that is Longus coli muscle, the first one, Longus capitis muscle, the second one, Rectus capitis lateralis and Rectus capitis anterior, these are the four muscles which is categorized in the prevertebral group of muscle. So I would also like to describe the origin, insertion, action and the nerve supply of these muscles, because generally the student don't read these muscles in detail and this MCQ is about these muscles. So I would like to give the detail of each individual muscle. So starting with the first, so let me explain here itself and then we will go into the description. So let me slightly enlarge the diagram. Yeah. So I would like firstly to describe about Longus coli muscle. Now Longus coli muscle actually has got three parts. It has got three parts. It has got a superior part, the middle vertical part and the inferior part. So this is the inferior part which you are seeing. This part is the inferior part. This is the inferior part of Longus coli muscle. This is the superior part of the Longus coli muscle. And the middle part which you are seeing as a strip, as you can see like a strip, these parts which I am highlighting in the green color, this is the vertical part or the middle part. This is the V or the middle part of Longus coli muscle. So as we can see, there is three parts of the Longus coli muscle. What is it? Superior, inferior and the vertical, which is also called as the middle part. So V means vertical, or it is also called as the middle part of longus coli muscle, middle part of longus coli muscle. So let's start with the description of each part. Now longus coli muscle, the first point is that the longus coli muscle, which is highlighted in the diagram, is the most medial group of muscles of the prevertebral group of the muscle. So in this diagram we are seeing 4 muscles which is categorized as the prevertebral group of muscle. In this category, longus coli muscle is lying most medially, which can be seen in the diagram also. Yeah. So now the superior part, if I talk about the superior part, of longus coli muscle, which is highlighted in the pink color. So this superior part arises from the anterior tubercle of the transverse process of C3, C4 and C5. Okay. So it is arising from C3, C4 and C5, transverse process of C3, C4 and C5, and it passes upward. The direction of superior fibers is ascending upward and getting attached to which group of cervical vertebra? It is getting attached to the anterior arch of atlas. So what is this cervical vertebra? This is atlas. So what you can appreciate, it is attaching onto the atlas cervical vertebra anterior arch. Okay. So I will write all these information, don't worry. So let's write firstly the anterior part. Again we will come to the diagram. Okay. Longus coli muscle, the first muscle of this group, which is the longest and the most medial muscle. So longus coli muscle, which is also called as longus cervicis muscle. Okay, longus cervicis muscle. It is the longest muscle of this category and the most medial, prevertebral muscle, most medial prevertebral muscle. Okay, that we have seen in the diagram. Now if I tell about the whole extent of the muscle, if we talk about the whole extent of the muscle, so let me again show you this diagram. So I would like a fresh diagram. So if I tell you about the whole extent of the longus coli muscle, which is from here to here, let me just highlight this muscle. So if I talk about this whole muscle which I am highlighting is the longus coli muscle. Okay. So this muscle, it is extending, the whole muscle is extending till the level of, this is third thoracic vertebra. So it is extending till the level of third thoracic vertebrae. It is extending till the level of third thoracic vertebra. Okay. And on the upper aspect, what we can see, it is extending to the atlas of anterior arch. It is extending to the atlas cervical vertebra anterior arch. Okay, so this is the whole extent. So write down whole extent of the muscle is, if you talk about the whole extent of this muscle, it is extending from anterior arch of atlas vertebrae till which thoracic vertebra? Till the anterior aspect of third thoracic vertebrae. Third thoracic vertebrae. Till the anterior aspect of third thoracic vertebrae. What it is written? It is written third thoracic vertebrae. Okay. Now let's see the first part. What I told you, it has got 3 parts: superior, inferior and the middle part. The middle part is called as the vertical part. So let's discuss the individual part. So firstly we will discuss the superior part. So write down, the first part is called as superior. It is also called as the upper oblique part. Upper oblique part, which is the superior part of the longus coli muscle. It is the superior part of longus coli muscle. So this part arises from anterior tubercle of transverse process of C3, C4 and C5 cervical vertebra. So it is arising from the anterior tubercle of the transverse process of C3, C4 and C5 cervical vertebra, and then it is ascending in upward direction. Thereafter it ascends upwards and medially to be attached on or inserted on, and it get inserted. Where it is getting inserted? As we have seen, it is inserting onto the anterior arch of atlas cervical vertebrae. So it is inserting onto the anterior arch of atlas cervical vertebrae. So this is the first oblique part. Now let's discuss the second part. So let me write the content and then I will again show you in the diagram. So what is the second part? If I talk about the second part is the middle or the vertical part. It is the middle or the vertical part of longus coli muscle. So again, starting with the origin and insertion. So it arises from the anterior aspect of the body of upper 3 thoracic vertebrae and the lower 3 cervical vertebrae. So it arises from the front of the bodies of upper 3 thoracic vertebrae and lower 2 or 3 cervical vertebrae. Lower 3 cervical vertebrae. Okay. So this is the origin, and the vertical aspect or the vertical part of longus coli muscle again ascends. So it is also ascending up. So it ascends. If we talk about insertion, so again these fibers are ascending up to be inserted onto the bodies of 2nd, 3rd and 4th cervical vertebrae. So it is inserting on the front of the bodies of second, 3rd and 4th cervical vertebrae. Okay, so let's see the second part. So we have already seen the 2 parts. Now can you see the green color highlighted area? So this whole area which I am highlighting, this is the second part or the vertical part. So it is again starting from the anterior aspect of the thoracic vertebrae. As you can see, the upper 3. So T1, T2 and T3, it is ascending from here, and again, and also it is getting origin from the lower 2 or 3 cervical vertebra. So you can see C7, C6 and C5, and from here the fibers are going and inserting into the transverse process of, so if you will see, these fibers are inserting onto the transverse process of 2nd, 3rd and 4th cervical vertebra. So it is going and attaching onto the 2nd, 3rd and 4th cervical vertebra. So actually these vertical part which you are not able to highlight this because it is overlapped by the superior part. So but the middle part which you are seeing, actually 3rd, 4th and 5th. So 3rd, 4th and 5th cervical vertebra I have marked here, 3rd, 4th and 5th. that is giving origin to superior part. So below that it also gets ascends and inserted. So it is covered by the superior part, but longus coli muscle is inserting onto the second, third and fourth cervical vertebra. Okay. So now coming to the third part. Now coming to the third part. The third part is the inferior or oblique part, that is inferior oblique part. Inferior oblique part. Now this is the smallest part. This is the smallest part of longus coli muscle. This is the smallest part of longus coli muscle. It arises in front of the bodies of upper 2 and 3 thoracic vertebrae, and thereafter these fibers are inserted. It goes upwards and insert onto the 5th and 6th cervical vertebra. So from here it is inserting onto the 5th, 6th cervical vertebra. So it arises in the front of the bodies of the upper 2 thoracic vertebra, and after that it inserts onto transverse process, to be more specific anterior tubercle of the transverse process, anterior tubercle of transverse process of 5th and 6th cervical vertebra. So again I would like to show you the third part in the diagram. So let me again rub this. Now, so as I told you, it is arising. It's arising from the thoracic vertebra, that is upper 2 or 3 thoracic vertebra, means it is these lower parts. So this part, this is the arising part, upper 2 or 3, and from here it is inserting. If you will see these parts, so it is inserting onto the C5 and C6 cervical vertebra. So arising from thoracic vertebra, so either T2, T3 and T1, upper 2 or 3, and getting ascending, this is the smallest part, and getting ascending to be inserted on C5 and C6 cervical vertebra. So this is the third part of the longus coli muscle. So thereafter, so we have done with this. Now moving to the action and the nerve supply of longus coli muscle. Okay, action and nerve supply of longus coli muscle. So nerve supply, starting with the nerve supply. Nerve supply. It is supplied by anterior rami of C2 to C6 spinal nerves. C2 cervical, second cervical to 6th cervical spinal nerves. So yes, we have done with the nerve supply. Now moving to the action. If we talk about the longus coli muscle, so I am giving the details of these muscle because actually the prevertebral group of muscle, we generally when we are in the our UG level, or we doesn't read very details of this origin, insertion and all. So as the MCQ is about the prevertebral muscle, so it is important to know the details of each individual muscle. So action, it flexes the neck. It flexes the neck forward. So altogether, if you tell it flexes the neck forward, it is correct. But if we want to add on more on the superior and inferior part, so as a whole it is flexing the neck forward. And if we talk about the, in addition to it, if we talk about the superior or oblique part, if we talk about the upper oblique part, it flexes the neck laterally also. It flexes the neck laterally also. It flexes the neck laterally. In addition to it, if we talk about, so in addition to it, if I talk about its lower part, so if we talk about the lower oblique part, of longus Coli muscle. Okay. So this is also rotating the neck to the opposite side. So it is rotating the neck to the opposite side. So this is all about the longus coli muscle, which was a most medial and the longest group of prevertebral muscles. We have discussed the three parts. We have discussed the origin, insertion, action and nerve supply. So after that, I would like to tell you about the second muscle in this group. Let me again show you the diagram. Okay. The second important muscle is longus capitis muscle. Longus capitis muscle. So let's discuss the longus capitis muscle, this one. Longus capitis muscle. So longus capitis muscle, if we talk about the capitis muscle, it arises from the anterior tubercle or the transverse process of C3, C4 and C5. So see here, this is C3, this is C4 and this is C5. Okay. So as you can see, it is arising from the transverse process of C3, C4 and C5. To be more specific, anterior tubercle on the transverse process of C3, C4 and C5, and it ascends upward and get inserted. It is getting inserted into the which bone? Occipital bone. To be more specific, the basilar part of occipital bone. So this part, as you can see here, so it is inserting here, and this part is the basilar part of occipital bone. So let's write the detail of longus capitis muscle. Longus capitis muscle, the second muscle in this category. This is the second muscle in the prevertebral group of the muscle, and this muscle arises from, let's talk about the origin. This muscle, if I talk about the origin, this muscle arises from anterior tubercle, which is located onto the transverse process. So which is located on the transverse process of C3, C4 and C5, and in some book it is also written C6. Okay, so that is also right. C3, C4, C5 and C6 cervical vertebrae. And it inserts, if we talk about insertion, it is inserting onto the occipital bone. Okay, so it is inserting onto the basilar part of occipital bone. Occipital bone. It is inserting onto the basilar part of occipital bone. If you want to be more specific, it is inserting onto the sides of pharyngeal tubercle. Pharyngeal tubercle, which lies in the basi occipital bone. It is just lying on the lateral aspect of the pharyngeal tubercle, which is lying in the basilar part of occipital bone. Yeah. So we have done with this. Now also I want to describe you about the action and the nerve supply. So yes, write down action. If I talk about the action of the capitis muscle, it is flexing the head, flexion of head. It is flexing the head. And if we talk about the nerve supply, so nerve supply is by anterior rami of or ventral rami of C1, C2 and C3. Anterior rami or ventral rami of C1, C2 and C3 cervical nerves. So yes, we have finished with this. Now what remains? Two more muscle, that is the capitis anterior, rectus capitis anterior and rectus capitis laterally. So let's see the muscle. So again moving to this diagram. So now I want to explain firstly and then I will write down the details of the muscles. Okay, so now let me just highlight, and you can just focus on to the rectus capitis lateralis and rectus capitis anterior muscle. So here this is the rectus capitis lateralis muscle, and lower to it is the rectus capitis anterior muscle. Okay, so these are small muscle as you can see in the diagram. So starting with the first muscle, that is rectus capitis anterior muscle. Okay, rectus capitis anterior muscle is arising from the anterior surface of the lateral mass of the atlas. So as you can see, this is the atlas. This bone which you are seeing here, this is the atlas bone, and rectus capitis anteriorly is arising from the lateral part of the lateral mass of the atlas bone, and it is going further in upward direction. It is passing in the upward direction. It is passing in upward direction. Okay, so with pink color I am highlighting this muscle. It is passing in upward direction and getting inserted onto the inferior aspect of basi occiput muscle, just in front of occipital condyle. Okay, just in front of the occipital condyle. So it is also inserting onto the inferior aspect of basi occiput, just in front of occipital condyle, and just lateral to it, the another muscle which you are seeing, just lateral to it, this muscle which you are seeing, this is the rectus capitis lateralis muscle. Rectus capitis lateralis muscle, as you can see, it is also attached in the diagram on the transverse process of atlas. So this is also attached on the transverse process of the atlas cervical vertebra, and it is also going upwards, but it is attaching lateral to that of rectus capitis anterior muscle. Okay, so now write down the origin insertion of each one. Okay, so starting with the first, that is rectus capitis anterior muscle. Rectus okay, write down rectus capitis anterior muscle. Rectus capitis anterior muscle. So rectus capitis anterior muscle, this arises from, if we talk about the origin, so firstly I am talking about the origin. So this arises from anterior surface of lateral mass of atlas, atlas cervical vertebrae, atlas vertebrae. And if I talk about the insertion, it is inserting on the inferior surface of, basi occiput, just in front of the occipital condyle. To be more specific, its insertion is lying in front of, occipital condyles. Okay, so nerve supply and action we will discuss all together. Rectus capitis anterior muscle. Okay, now coming to the rectus capitis lateralis muscle. So let me just tell you about the second, that is rectus capitis lateralis muscle. Rectus capitis lateralis muscle. Now if I talk about the rectus capitis lateralis muscle, it arises from the upper surface of the transverse process of atlas cervical vertebra. It arises from upper surface of transverse process of the atlas cervical vertebrae, and thereafter it runs laterally upward. It passes laterally upward to be inserted onto the jugular process of occipital bone. To be more specific, you can say just one line also, that it is inserting laterally to that of rectus capitis anteriorly, but if you want more precise, you can say inserting, it is inserting insertion is, it is passing upwards and laterally to be inserted on jugular process of occipital bone. Okay. So yes, we have finished with all the muscles, origin and insertion, and what remains is the nerve supply. So the nerve supply of both the muscles. So moving with the nerve supply of both the muscles. Now both rectus, capitis anterior and that of lateralis is getting nerve supply from ventral ramus of first cervical nerve. It is getting nerve supply from ventral ramus of first cervical nerves. Okay. Now rectus capitis laterally is bending the neck to the same side, and rectus capitis anteriorly is flexing the neck. So to be more specific, action rectus capitis anterior one, it is bending, it is flexing, it is causing flexion of head, that is okay. And when I talk about rectus capitis lateralis, it is bending the head to the same side, it bends the head to same side. So yes, we have finished with this. We have done all the axial nerve supply, origin, insertion. In short, we have finished one small topic, that is prevertebral muscle. So again, moving to the MCQ. So now it's very easy to answer the MCQ, as we have already seen that in this category, which is not a muscle of anterior vertebral muscle, which is not an anterior vertebral or prevertebral muscle, the answer will be splenius capitis. Splenius capitis muscle is not categorized to be a prevertebral muscle. Prevertebral muscles are 4: longus coli, longus capitis, rectus capitis anterior and rectus capitis lateralis. Okay. Now moving to the second MCQ. Now recto-sigmoid junctions lies anterior to, recto-sigmoid junctions lies anterior to which of the following structure? The options are S3 vertebra, means third sacral vertebra, prostrate obturator foramen, or that of urinary bladder. So this is a direct MCQ in which you have to just know the location of the junction between rectum and that of sigmoid colon. So the correct answer is, it's a direct question, so not much of explanation is necessary. So the correct answer is S3 cervical vertebra. I would like to show you a diagram which will clear you the location of recto-sigmoid junction. So see here in this diagram, you can see this recto-sigmoid junction, that is it is exactly at the level of S3 cervical vertebra. So this is the junction which is corresponding to the level. Let me just enlarge it. So if you are seeing this diagram, it is exactly at the level of S3. So recto-sigmoid junction corresponds to third sacral vertebra. So yes, we have done with this. Now moving to the next MCQ. Which of the following structure extends into labia majora? So options are given: suspensory ligament of ovary, ligament of ovary proper, processus vaginalis, and round ligament of uterus. So which of the following is extending till the labia majora? This is the question. So I would like to explain it. So for the proper explanation of this, actually if you are seeing the descent of ovary, if you are comparing the descent of ovary and testis, so the descent of ovary is less in comparison to that of the testis, and it lies at the level of true pelvis. Okay, so rim of the true pelvis. So descent of ovary occurs till the level of rim of true pelvis, and after that there is formation of ligaments in its cranial and caudal part. Okay. So in the cranial part, it is forming suspensory ligament of ovary. So it is at the level of true pelvis and it is cranially forming suspensory. So that can be the answer. And caudally, it forms ligament of ovary, and also it forms round ligament of uterus. Now this round ligament of uterus is the correct answer, and this is going down till the level of labia majora. So I would also like to discuss the whole course of round ligament of uterus. It will make you better understand this topic. So firstly, write on this. So correct answer, as we have seen, as I told you, the correct answer is round ligament of uterus. Now descent, if you talk about the descent of gonads of both male and female. So descent of gonads is less in females as compared to males. So descent of gonads is less in females as compared to male. So where it lies, if I talk about the descent, where it lies, so the ovary is settling finally. The ovary is settling finally at the level of just below the rim of true pelvis. So it is lying just below the rim of true pelvis. So these all landmarks are important, so I am writing whole of it. Yeah. Now again it will have an attachment cranially and caudally. So cranial genital ligament. If we talk about cranial genital ligament, so this cranial genital ligament is forming suspensory ligament of ovary. Suspensory ligament of ovary. Okay. Whereas if I talk about the caudal part, so this was about the cranial part, and when I talk about the caudal part, so caudal genital ligament forms two of it, that is ligament of ovary proper, and the second is round ligament of uterus. Round ligament of uterus. Okay. So in short, I also like to tell you about the whole course of round ligament of uterus. So let's see this diagram also for that. So this will describe the whole course of the, so this ligament is, round ligament of uterus is arising from the lateral aspect of the uterus, okay, and approximately the length is whole 10 to 12 centimeters, okay, 10 to 12 centimeters, a fibromuscular band. It is arising from the lateral aspect, as you can see, and here on the lateral aspect there is a relation of three structures: ligament of ovary, the uterine tube, and that of the round ligament of uterus. So it is also important to know, I will also show you the diagram, what is the relation of these three structures on the lateral aspect of the uterus. So actually round ligament of uterus is related antero-inferior to the fallopian or uterine tube, and ligament of ovary is lying postero-inferior to the uterine tube. I will show you the further diagram which will make you clear. Here you are seeing the sagittal section, but I will show you the more superior view and the dissected diagram which will make it clear. Okay. Now round ligament of uterus is arising from here and then begins from the lateral angle of the uterus, then passes forward laterally. It is actually lying between the two layers of the broad ligament. It is lying between the two layers of the broad ligament. It further passes and actually it released from passing through. After that it passes in relation with the inferior epigastric artery. So it will pass in relation with the inferior epigastric artery. Actually it passes, it is not shown here, but it is passing on the lateral side of the inferior aspect, inferior epigastric artery, then passes through the superficial inguinal, it passes through inguinal canal and emerges out through the superficial inguinal ring and then merges with the labia majora. So firstly, in short, let me write the whole course of the round ligament and then we will see further diagrams which will make you more clear. So write down the whole course of the ligament. So write down course of round ligament of uterus. Course of round ligament of uterus. So what I told you, it is 10 to 12 centimeters in length. Okay, it is fibromuscular band. It's a fibromuscular band arises from and starts from the lateral aspect of uterus, which is passing between, it is passing between two layers of, it is passing between two layers of broad ligament it is passing between two layers of broad ligament. Then it enters into the deep inguinal ring, passing between the two layers of broad ligament. After that it enters into deep inguinal ring, deep inguinal ring. Okay, after winding, so in this relation it is reaching in the deep inguinal ring after winding around lateral side of inferior epigastric artery, lateral side of inferior epigastric artery. Okay. Okay, then it passes through the inguinal canal. It passes through the inguinal canal, emerges out. So it is passing through the inguinal canal, then emerges out from superficial inguinal ring. Then splits into numerous thread-like structure. Splits into numerous thread-like structure, fibrous band, which is merging with the labia majora. So it is merging with the fibroareolar tissues of labia majora. So thereafter this fibrous band will merge with, it is going to merge with fibroareolar tissues of labia majora. Okay. So this is the whole course. Further, I also want to show you another diagrams which will show you the relations of this important structure. So see this diagram. Yeah. Now, here you can see, so I am using green color for uterine tube. So I am using this green color for uterine tube. This is the uterine tube. I am using red color for the ligament of ovary. This is ligament of ovary, and I am using blue color for the round ligament. So this is round ligament. Okay. Now, actually the round ligament of uterus, let me just enlarge it. Just see this part. Okay. So when you will see, this is the seeing whole of the structures, the whole of structure superiorly. So Okay, what you can see here and what you can appreciate, the ligament of ovary. If we talk about the ligament of ovary, so the ligament of ovary, just write down here important relation. So red color for ligament of ovary, it lies postero-inferior. The important relation is that it lies postero-inferior to uterine tube. So we are taking the landmark fallopian tube, that is uterine tube. And if I talk about the round ligament, if I talk about the round ligament of uterus, so round ligament of uterus is lying antero-inferior to uterine tube. So one is lying postero. So this is important landmark which is often asked for MCQs. So what is the relation of these three structures? And in this diagram you can clearly see these three structures are emerging out from the lateral aspect of the uterus. So let me just show you what you can see here in this diagram, that this is the outline of the uterus which you are seeing. So you are seeing the outline of uterus, this is the outline of uterus, and from the lateral aspect these structures are emerging. And what is the relations on the lateral aspect? This is shown here and highlighted. Now let's see one more image. This is the cadaveric image. So this is the cadaveric image which will make you clear about the relations. Okay, so see here you can see the uterine tube, and also what you can see, this is the round ligament. So this is the round ligament of uterus, and you can see, yes, it is lying anterior but inferior. Round ligament of uterus is lying anterior and inferior to uterine tube, anterior and inferior to uterine tube. Okay. Now, so all the structures you can see here. Now moving to the next MCQ. Which of the following is not contained in infratemporal fossa? Which of the following is not a content of infratemporal fossa? The options are temporal lateral pterygoid or medial pterygoid muscles, maxillary artery, pterygoid venous plexus, and pterygopalatine ganglia. So for this I would like to explain the content of temporal fossa, infratemporal fossa, and also the boundaries. But here the right answer is, correctly I want to tell you about the answer, that pterygopalatine ganglion is not a content of infratemporal fossa. Actually this ganglion is a content of, the pterygopalatine ganglion is a content of pterygopalatine fossa. It is a content of pterygopalatine fossa, and this is not a content of infratemporal fossa. In terms of infratemporal fossa, the important ganglion which lies here is the otic ganglion and not the pterygopalatine ganglion. So let's see the explanation. So firstly I would like to explain the location of infratemporal fossa and then with the important structures lying inside. Okay. So in short, by covering the MCQ, I want to cover the important topics also which is related to this MCQs. So I am giving the details of each and every part. So can you see the arrow marked structure that is marked in the red arrow? That is the location. This is showing that, yeah, this arrow is showing that the arrow is going in upward direction from which area? From the infratemporal region. So this is the region of, this region which you are seeing, this is the region of infratemporal fossa. This is the region of infratemporal fossa. Infratemporal fossa. Okay, let's see the boundaries. So here itself I want to show you the boundaries. So it is bounded. So let me just again rub it, or we can explain here. This diagram is better to understand the boundaries of infratemporal fossa. So its roof is formed by the infratemporal surface of greater wing of sphenoid. So can you see here, this is the greater wing of sphenoid. This part is the greater wing of sphenoid and it is lying on the superior aspect. So if we will see the greater wing of sphenoid lower aspect, that is called as the infratemporal part. So okay, so this is infratemporal crust. So greater wing of sphenoid is shown, and infratemporal surface of greater wing of sphenoid is forming the roof of infratemporal fossa. So it is lying superiorly. If we talk about the inferior aspect roof, no, if we talk about the floor, so it is open. As you can see, this whole area which I am telling the infratemporal fossa, if I am telling whole this area as infratemporal fossa, so lower down it is open. So you can say base is open. Now moving to its medial wall. So medial wall, can you see this lateral pterygoid plate? So this is the lateral pterygoid plate, and lateral pterygoid plate lateral surface is forming its medial wall. Okay, so this is forming the medial wall. This is forming medial wall. The greater wing of sphenoid is shown, and the greater wing of sphenoid infratemporal surface is forming the roof. So yes, in this diagram, well cleared the roof and the medial wall, and we have already seen the base is open. The base is open. Okay, let me just explain it. I will write also, don't worry. And if I talk about the anterior aspect, so anteriorly it is formed by the maxilla, infratemporal. So this is the bone which you are seeing. Let me highlight it. This is the bone which I am highlighting here. This is the maxilla bone. Yeah, so this is the maxilla bone, and this maxilla bone will lie on the anterior aspect. Okay, so just imagine the 2D diagram is there, but you have to imagine it 3D. So this maxilla is lying anteriorly. So maxilla infratemporal surface means infratemporal surface below the temporal bone. It is forming its anterior wall. Okay, and posteriorly, if I talk about its posterior aspect, posteriorly it is formed by the stelloid process of the temporal bone. So here you can see the stelloid process. So this is the stelloid process, and this stelloid process is forming the posterior. This is forming the posterior wall. Okay, maxilla infratemporal surface is forming anterior wall. Maxilla infratemporal surface is forming the anterior wall. So yes, these are the important things: anterior, posterior, medial and lateral. So what is removed laterally is the ramus of the mandible. So here you are not seeing the mandible bone, but here you can see, for the proper visualization of infratemporal region, what is removed here. So this is the mandible, and what is not shown here, what is removed, the ramus of the mandible. So this is cut part of the ramus of the mandible. So the ramus of the mandible is removed so that you can approach to the infratemporal fossa. You can reach the infratemporal fossa. So in short, please write down the boundaries and then we can discuss the contents. Boundaries of infratemporal fossa. Roof is bounded by infratemporal surface of greater wing of sphenoid. Base is open. Medial wall medially formed by, medial wall is formed by lateral surface of lateral pterygoid plate. Lateral wall which was removed to show you the location of infratemporal fossa, and the lateral wall is formed by ramus of mandible. Posterior wall is formed by stelloid process of the temporal bone. and anteriorly it is formed by the maxilla bone. Anterior wall is formed by infratemporal surface of maxilla bone. Infratemporal surface of maxilla bone. So yes, we have done with the boundaries of infratemporal fossa. So quickly I would like to, we have already done the answer, but I would like to give you the structures, list of the structure which is forming the content of infratemporal fossa. So the important structures are muscles. So firstly, the important contents are the muscles. So 3 muscles, medial and lateral pterygoid and the temporalis muscle. Then it contains ganglion and the nerve. So write down contents of infratemporal fossa. Contents are, first is muscles, lateral pterygoid, medial pterygoid, temporalis. Blood vessels, maxillary vein is there as a content, pterygoid venous plexus, pterygoid venous plexus. And lastly, the content are the nerves. So just write down the nerves. So I would like here itself the content. So we have done with the muscles, blood vessels and also with the nerves. So the content are, it contains following nerves: mandibular nerve, it contains otic ganglion and coda tympanic nerve. Coda tympanic nerve. So yes, these are the list of structures. So yes, which ganglion? Otic ganglion is the content and not the pterygopalatine ganglion. All these structures was the different options, and pterygopalatine ganglion is a content of pterygopalatine fossa. So let's move to the next MCQ. Okay, which structure is passing between the gap of superior constrictor muscle and the skull? Which structure passing through the gap between the superior constrictor and the skull? So 4 options are there. So firstly, I would like to tell you about all the gaps between the constrictor muscles and what structures is passing through it, and then we will again come to this MCQ. So this is a schematic diagram which will help you to understand the structures passing through different gaps. So the first gap is here. Firstly, let me explain. This is the first gap which is between the base of the skull. So this is base of skull and that of superior constrictor muscle, and this gap is called as foramen of Morgany. This gap is called as Morgany space of Morgany or foramen of Morgany. The structures passing which is shown in this diagram is auditory tube. You can see the auditory tube here. This is the auditory tube. Also one muscle, that is levator palatini or levator villi palatini muscle is there. Other than that, one more artery is also, this is ascending palatine artery. This is ascending palatine artery. And one more, sometimes the palatine branch of one more structure is there, that is palatine branch of ascending pharyngeal artery. Now moving to the second gap, that is the gap between superior and the middle constrictor muscle, and it contains one nerve, glossopharyngeal, and the muscle supplied by that nerve, that is stylopharyngeus muscle, two structures. Now coming to the gap between the middle and that of inferior constrictor, and the structures passing is one nerve and one vessel, superior laryngeal vessels and internal laryngeal nerve, as you can see. And the lowermost gap is below the inferior constrictor muscle, and the structures passing is recurrent laryngeal nerve and that of internal laryngeal vessels. Okay, recurrent laryngeal nerve and that of internal laryngeal nerve and internal laryngeal vessel, which is shown here, as you can see. Okay, so these all structures are shown here. Now I would like to tell you about the details of each of it. I would like to, this diagram is self-explanatory, but also I would like to give you the details so that you can revise it afterwards. So write down the gap between base of skull, the gap between the base of skull and superior constrictor muscle, okay. So this is the first gap, and the structures passing through these gap are following. The structures passing are 4, so you should complete this list. That is one muscle, the muscle is levator veli palatini, auditory tube artery, the artery is ascending palatine artery, and the last one is palatine branch of ascending pharyngeal artery. So 4 structures, as you can see, 4 structures are passing through the gap between the base of the skull and that of superior constrictor muscle, which is called, this gap is given a name, the name is Morgany gap, or this gap is called as Morgany gap, sinus Morgany. Now coming to the second gap, the second gap is between superior constrictor muscle, it's a gap between superior constrictor muscle and middle constrictor muscle. The gap between superior constrictor muscle and that of middle constrictor muscle, and the gap contain following structures. The structures contain is one nerve and one muscle. The nerve is glossopharyngeal nerve, and the muscle which is supplied by the glossopharyngeal nerve. The muscle supplied by glossopharyngeal nerve is, as you must be knowing, that is stylopharyngeus muscle. Stylopharyngeus muscle. Now moving to the third gap, the gap between the, now moving to the third gap, that is the gap between the middle constrictor and inferior constrictor. So write down gap between, the third gap is the gap between middle constrictor muscle and inferior constrictor muscle. The structures passing is superior laryngeal vessel, superior laryngeal vessel, internal laryngeal nerve. The fourth gap, the gap below inferior constrictor muscle. Now, if we talk about the gap below inferior constrictor muscle, the other name of this gap is tracheoesophageal groove. So, this gap is also called as tracheoesophageal groove, and the structures passing through it is tracheoesophageal groove is two structure, one nerve and the vessel. The nerve is recurrent laryngeal nerve, RLN, recurrent laryngeal nerve, and the vessel is inferior laryngeal vessel. Inferior laryngeal vessel. So, with this we have finished all the MCQ, and before ending the session I would like to give you some important details. So, grand test of Neet PG 2021. So, you can join this session. So, this is absolutely free session which will be on the Unacademy platform. This will be taken on, the test is on 10 AM. So, please join the test, the grand test for Neet PG 2021 at 10 AM 20th September. And also please do join the explanation of the anatomy part of this grand test by me. That will occur on 21st September. That will occur on 21st September morning 8 AM. 8 AM in the morning. Okay. So, please do join this. This will be a useful session, and please, this is absolutely free on the special free sessions of Unacademy platform. The test is on 20th September 10 AM and the discussion of MCQ of anatomy subject is by me. That is 21st September 8 AM in the morning. Okay. So, this was one information. Now, coming to the other information, there is an iconic subscription in which Prep Ladder and the Unacademy is merged. So, you can, if you wish to buy it, you can use my referral code Dr. Lisa 10 for 10% discount. I would also like to give you the information about Operation Neet PG 2021 batch. So, you can join this batch. Again, you can use my referral code Dr. Lisa 10, or you can use my referral code, that is Dr. Lisa -YT. Both of this are my referral code, and with that you can join this Operation Neet PG 2021 batch. Okay. And just I am ending the session. Before that, I would like to tell you about Unacademy Plus platform. Yeah. So, on this platform you can find me. You can also find me on my Telegram group link, that is at the rate of Monalisa Anatomy. Monalisa Anatomy. So, you just search Monalisa Anatomy on the Telegram group link. You will find my group, and do join this group for any kind of doubt related to anatomy subject. You can join my Facebook group Dr. Monalisa Anatomy. You can watch the free live session which is occurring, which is also updated on the group, also on the Unacademy Neet PG platform, also on the Mind group. So many free live sessions are there. Like one of the upcoming session I have told about 21st September 10 AM in the morning. 8 AM in the morning. The test is, sorry, on the 20th September the test is, please do join that grand test. 20th September YouTube session is there. You can follow me on YouTube series. Like today the session was of Neet PG MCQ discussion of 14th part, and those who have missed the previous one, they can just revise it. Okay, you can use my referral code for 10% discount. All the best. Keep studying. Thank you so much. All the best.